Now, COVID in the brain. We have three different studies here for you. One is long COVID is associated with severe cognitive slowing. This was a very interesting paper in the UK and Germany. They took 270 people who had long COVID and they compared them to two other groups. One, people who had got COVID, but they said they're not experiencing any long COVID symptoms, and another group who didn't have long COVID and had not gotten COVID. And you can see at the bottom left diagram that on this objective test, I think it was a reaction time test, so it's not everything, but it's part of cognition, that they were objectively slower 30%, around 30% of those who said they were fine, they had objectively slower results on this test. So that's pretty remarkable. I was not expect that. Before this study, I thought most of the cognitive slowing would probably come with people who have long COVID, but it shows you that even with mild illness, you have a little bit of this effect. And also wanted to share this. This actually came out last week. It was a challenge study, so it took healthy volunteers. This actually applies to folks like myself, the age of 22, 23. They took 34 unhealthy, unvaccinated, immune-naive volunteers in the beginning of COVID. I'm not sure why it took them so long to publish this. However, they compared their cognitive scores, executive function, memory scores, up to 1 year later, and they also found that there was a little bit of a reduction in the performance, in the cognitive performance, and interestingly enough, that the volunteers reported no persistent subjective cognitive symptoms. Again, take this what you will, but it seems to affect the brain a little bit. We don't know exactly how. There's some theories. Again, an interesting effect on the brain. This was for people who are hospitalized, 351 hospitalized patients. Then they compared them to matched controls, and what they found was the cognitive deficits was equal to magnitude of 20 years of aging. That is quite remarkable, with objective evidence of ongoing brain injury and reduced gray matter volume. Now, we want to scare people. It's more of a be alert and don't have health complacency when it comes to repeated COVID infections. It's not just like the cold. I don't think we see this with the cold or with the flu or something like COVID, where it's so predominant. This much effect is quite alarming.
I don't know about you. This scares the shit out of me. So the initial round of people that getting sick with COVID, you lost 20 years of brain function. Your neurons don't bounce back. They don't have this neuroplasticity. You can't just regrow neurons at your leisure. So we have a series of trials that show this, that people who got COVID and they didn't get very sick or they were fine, their brain function was reduced compared to people who never got COVID, or say who never got COVID, and the people who got sick from COVID got the worst brain function. We know that COVID's been shown associated with strokes. We know it's been shown with microthrombus in the brain. It's been associated with brain fog, cognition issues. So, my brain is getting old and it's wearing out, and COVID will accelerate that process. And some people who got initially very sick at the beginning, it's estimated they lost 20 years of their brain function. I'm not too happy with this information. I'm scared about this information. Now, the virus is not as strong as it was before, but these trends will continue. And people who say that I felt fine with my COVID, when you test the brain, it's not as sharp as the people who never got COVID. And these symptoms,
controversial study as well.
They don't go away.
Yeah, no.
It's like you lose your brain function, you lose your brain function.
Now, let's talk about the best way to prevent it is actually vaccination. We have this data right here showing people who are unvaccinated at higher risk, and then with each additional up to the third dose, we see reduction. We actually don't have good data beyond that. We only have observational data from two other prominent long COVID researchers. At the bottom right here, Dr. Tropol has written some reviews, and also Dr. Ali. He's been doing a lot of primary papers and looking at the VA, the Veteran Affairs System, looking at long COVID. And their observational data showed that vaccination reduced long COVID risk by about 40%. I think, Dr. Curnew, you mentioned that 40% mark as well. Some of the other potential things that have been mentioned and looked at, one was Paxlovid, we mentioned, as prevention, not as treatment. And convalescent plasma is another one in more severe cases, and steroids in the right person, of course. So the second phase, the inflammatory phase in the second week, that actually does a lot of damage. I was reading a review that they said for the brain effects, the brain deleterious effects, there was two potential hypotheses. One was hypoxia, low oxygen saturation, and one was the inflammatory phase that occurs. So we have some of these potential things. Again, the details you have to discuss with your physicians and so on and so forth.
The best way to prevent long COVID, next slide please, forward, is don't get sick. Don't get COVID. So if people are sick, avoid them. And if you're sick, don't get other people sick. During the Olympics, I can't believe this American super athlete, has COVID, and racist. I think that's a very selfish act. I understand he trains all his life for this. I get it. It would have been better if and everybody thinks that's okay. I don't think that's okay to make other people sick. So if you're sick, isolate yourself, test yourself if you can, and if you have COVID, ideally isolation for 5 days and wear a mask for another 5 days. So that's 10 days. Now I understand that life gets in the way and we can't always do all the things we want to, but that's the AT for preventing infection. Wearing a mask protects other people, and it protects you by reducing your chance of you getting respiratory illness by 30%. We have HEPA filters. Yeah, it's about time that everybody think about getting a HEPA filter. Be outside. You're 40 times less likely to get COVID outside compared to inside. And get your vaccines. Yes, there's reactions to the vaccines. They're pretty small and pretty rare at this stage. And if you get COVID, treat it with Paxlovid if you're at high enough risk. Um, Steroids are for basically for sick people. Blood clot dissolving agents are for sick people. These are for hospitalized patients. And if you give steroids in the first week of COVID, you actually increase mortality because you allow the virus to replicate. During the second phase, this cytokine storm, your immune system is overactive. That's when you calm it down with steroids. It's amazing what we've learned so far. And I'm so tired about the politics of everything. We still have a lot more to go. And the long-term effects. The thing that worries me the most is that what is getting COVID 2, 10, or 15 or 5 times of your lifetime going to do to your long-term health? I don't think it's going to be a good thing. I may be wrong, but I'm going to be cautious about this, and I'm going to take the steps I can to avoid making myself sick and make other people sick, and take the precautions, including vaccination. So you convince me if I get COVID and I'm starting to have respiratory symptoms on day 1 or 2, I'm going for Paxlovid right away. If I because I'm 65 years of age, and my immune system is that not of a 20-year-old. And I also learned is that you can strengthen your immune system by being skinny, exercise, controlling risk factors as well.
And last thoughts, we just wanted to leave everybody with this page. If you want to learn more, you can go into depth. They have office hours, microbe TV, ask all your virology questions, infectious disease questions, anything you have. Anybody who's curious, we encourage you to check this page out. It's lovely. They've grown over time. I think they started in 2010, a long time ago, and they've made quite progress.
I would really encourage people to go to Micro TV, and what these experts talk about is that they feel very strongly about Paxlovid. If you're over the age of 65 or has risk factors, and they remind us that in the United States right now is 1 to 4% of mortality per month is related to COVID. And most people who get COVID have other illnesses as well. We have most of us, as we get older, have chronic disease. And we also realize that the last few years of life can be spent in illness or in health. So what I'm encouraging people to do is to become active. So what I'm doing is I'm trying to is really exercise 14 hours a week, vigorous activity, increase muscle, lose fat. During this presentation, I took my cholesterol pills again. And I'm going to take, I just had an 8 during this presentation, and to basically lower my blood sugar, I should try to go for a walk after every meal for about 10 minutes to lower my blood sugar. So there's just so many things you can do for your health.